We turn to 5 on your health tonight, and a big setback for a medication once touted as a potential treatment for autism. The FDA now says that there is not enough evidence that the drug, say it for me, Dr. T, please.
Leucovorin.
Leucovorin offers any benefits. So here to answer your questions is Dr. Todd Ellerin from South Shore Health. Federal officials and the president started talking about this drug, Leucovorin, for the first time last fall. It sounded really promising at the time for a lot of parents, right? Didn't it, at the beginning?
You know, we heard about it, but we didn't see a lot of evidence supporting it. And what we know is that there was a label change by the FDA for Leucovorin, but it's for a very, very rare disease, a 1 in a million disease called cerebral folate deficiency. And Leucovorin is a type of folic acid, what we call folinic acid.
Right.
But what we realize and what the FDA has told us is there is not enough evidence to say that this will work for kids with autism, the majority. So we don't recommend it because we saw after we heard back in September about the potential for Leucovorin with autism, there was a significant spike in Leucovorin prescriptions.
Right.
And it just, there's no evidence to support it for the majority of kids.
Even with the spike in use, in other words, a larger plane of use, it still hasn't done it yet, right?
Well, right, and it's not something we recommend.
And it's not to be recommended.
And nor does the FDA recommend.
And at the same press conference, federal officials linked cases of autism to Tylenol taken during pregnancy. You may recall that. And you say that is flatly
not true.
Not true.
Not
a number of medical societies say that's not true as well. But do you worry that some parents still think that it is?
Of course, because we get mixed messages. But what I would say is that, and the other thing we noted after that we heard about Tylenol, it was that there was a significant decrease in Tylenol use of pregnancy, about 10%. And why is that concerning? The reason it's concerning, number one, is because untreated fevers in pregnancy can lead to other complications like neurologic problems. And the other thing is if pregnant women are not using Tylenol to reduce fevers, they may be using other things like Motrin, what we call non-steroidals, that can be harmful in pregnancy. So that's the thing. And the best studies that look at pregnancy, they do what's called matched sibling analysis. They show pregnancies where one child has autism, the other child doesn't. You know the genetics, right? It's the same mom. And what those show is that when mom uses Tylenol in one pregnancy and not another, there's no association. Between Tylenol and autism.
Time is up. We have to go. Yes or no answer to this, please. I hate to do that to you. 70 degrees today. It feels like spring. A different topic. Is the flu season over? Yes or no?
Down, but not out.
Down, but not out.
Going in the right direction.
All right, very good. We almost got him to say yes.
We have no cases at South Shore Hospital.
No cases at South Shore. There you go.
Okay.